Well, it's time now for our In Focus Health Update. And of course, we're joined by our health reporter, Linord Moudou. Hi, Linord.
Hello, Diarmid.
Thank you so much for joining us today. So you've got some news about the climate change and how it's affecting health.
Absolutely. It does affect human health. Representatives of the world's governments, international organizations, and civil society are concluding talks on climate change in Durban, South Africa. Experts say climate change affects human health on various levels. They say the consequences of climate change, such as sea level rise, flooding, hurricane, and drought, can lead directly to disease. The World Health Organization says globally water scarcity affects 4 out of every 10 people. A lack of water and poor water quality can compromise hygiene. Diseases affected by climate, such as diarrhea and malaria, currently cause millions of deaths worldwide. And joining us on the phone from Durban is Dr. Diarmid Campbell-Lendrum with the Department of Public Health and Environment at the World Health Organization. Dr. Campbell-Lendrum, welcome to In Focus.
Good afternoon.
Good afternoon. I wanted to talk about the conference, but before we do that, can you tell us about what the critical aspects of the impact of climate change on human health are? What would you say?
Well, the things that we're most concerned about from the point of view of the World Health Organization are that some of the largest disease problems that we have, problems such as undernutrition, malaria, diarrheal disease, people being killed in floods and droughts and so on, are highly sensitive to climate conditions. And so as we see temperatures continue to rise, as we see we have more extreme precipitation events, more floods and more drought at the same time, we're very concerned that we're basically eroding the environmental goods and services on which all human health depends. So we are already seeing some early signals of this, and we expect to see greater challenges to control some of our largest disease problems at the moment.
So what population is most at risk with regards to all these issues? Would there be women or children, or just it doesn't really matter?
Well, everybody is vulnerable to some extent, even populations in rich countries. I come from Europe, and we thought that we were pretty well protected from weather and climate, and then we had a massive heat wave in 2003, and there are about 70,000 more deaths than we would usually expect for that time of year. But it really is the poorest populations that are the most vulnerable, and then within those populations, it's, I would say, children more than others. When we did estimates of the total numbers of people that we think are being killed by climate change at the moment, about 85% of those were children in developing countries. So it really is the most vulnerable who will suffer the most.
Now, the conferences will conclude tomorrow. What were the highlights in terms of health-related issues?
Well, I think the real highlight for me has been that the wider health community has finally really engaged with the climate change issue. In the past, the World Health Organization has been present, and we've warned people. What's been different about this conference in Durban is that we've had a large group of health professionals, both with their country delegations, but also just with their professional associations, with non-governmental organizations turning up to give the health voice to the conference. And we think that ought to change things. We're making clear that we're not just talking about climate change as an environmental issue or as an economic issue. It really is an issue of health and survival. The final positive point that we have is that if the countries can sign an effective agreement, as we hope they will, if they can put money into health adaptation, there will be very large benefits to health.
Great. Dr. Campbell-Lendrum, thanks so much for your insight. And that was Dr. Diarmid Campbell-Lendrum. He is with the World Health Organization.